Thank you for the opportunity to speak today. I'll be talking about a project that we're running, a pilot study that's trialling the use of telehealth in cancer genetic counselling. So we know that there are lots of barriers that can prevent patients from accessing cancer care, and that includes cancer genetic counselling. We see patients who are unwell with cancer, who have lots of other appointments, and genetics is often not a top priority. We also see lots of older and younger people who have a family history, and they, depending on where they live, can find it quite difficult to come to clinic. So we're trying to see if we can reduce those barriers. Telehealth has been shown in our clinic when it's using a more old school hospital-based approach to be equivalent to face-to-face genetic counselling, but we haven't evaluated a direct-to-patient model before. So the aims of our study are to assess the reliability of direct-to-patient telehealth, and we're using the New South Wales supported program PECSIT for that, and to explore patient and genetic counsellor experiences with using this telehealth platform. So in our study, any adult non-urgent patient who's referred to our clinic, unfortunately at the moment we've only been able to include people that don't require an interpreter, although that's going to change, are eligible for inclusion in the study. And in our normal triage model, we offer people, in the first instance, a phone or an in-person appointment, depending on the contents of their referral. And then if the patient consents to the study, we randomise them within their triage category to receive either standard care or to try telehealth as the intervention. So the measures we're using are the K10 to assess psychological distress pre and post-appointment, the CARE consultation and relational empathy questionnaire to assess how the patient perceives the clinician's level of empathy, the telemedicine satisfaction questionnaire to measure satisfaction with telehealth, and some interview questions during the appointment to assess how the patient is going with the technology and if they're having any issues. Those are our numbers so far for the study. Still pretty small, but we're getting there. So the demographics of our study, the average age of our patients in the study is 45, but as you can see there's quite a wide age range from 23 to 75. Most of our patients are female, which really does reflect our clinic population, half are university educated, and the vast majority have actually tried some sort of video conferencing before. I've selected a few measures, a few items from the telemedicine satisfaction questionnaire and the data that we've been collecting. So these are the items, some of the items from the questionnaire, and the proportions of patients that either agree or strongly agree with the statement. And as you can see, it's generally quite positive data. Most patients report feeling comfortable communicating with their provider. They believe that telehealth provides for their healthcare needs and they would do it again. And it saves them time travelling to the clinic. There are clearly a proportion of patients, about 30%, that have trouble hearing their clinician, and that was certainly reflected in our other data that I'll show in a second. And I found it really interesting that 65% of patients thought they received better access to care by using telehealth, even though they were in a study and they knew that they were referred and they would get an appointment either way at that time. I guess interestingly with that comment is that the other 35% of patients are neutral about that statement. So they were all generally positive, I guess, about the access they were receiving. In terms of patient feedback, this is what they gave us feedback during the appointment. About 58% of patients reported that they liked the convenience of telehealth, that they could do the appointment anywhere, that they avoided travelling to the hospital and the time and the cost and challenges that are associated with that. 26% of patients thought that it was good to be able to see the genetic counsellor rather than just having a phone call. And most of the patients thought that was because it was really helpful to be able to build that rapport. One patient also thought it was quite useful to have a genetic counsellor that they could see so that they could understand inheritance. And if you've ever seen a genetic counsellor explaining inheritance, they do a lot of these ones. So that's what they meant, to explain, dominant and recessive and things. And 19% of patients who used telehealth at home reported that they felt more comfortable in that environment than they would have been if they'd had to come to clinic. Unfortunately, we did encounter some technical issues, as you can imagine. So about half of patients reported some level of technical issue. Most of these were issues with their sound and video during the session. And most of these we could resolve with a bit of troubleshooting. But that's not to say that they weren't there and they weren't an issue. But for 2 patients, unfortunately, we couldn't resolve the issues and they had to have their usual telephone appointment. So the implications for practice is that this is some very early data that supports the use of telehealth in cancer genetic counselling, thank you, as a acceptable, so far, intervention. However, there are definitely some technological challenges associated with using this, and I think it highlights the need for some really well-designed patient resources, but also help and support for patients and genetic counsellors and clinicians that are using this technology. In terms of future directions, we're going to finish the pilot very soon, and we're planning a multi-site randomised control trial for the end of the year, pending ethics. So we're planning to do a process evaluation to look at the barriers to implementing telehealth in the clinic. We're doing a discrete choice experiment to better understand patient preferences when they're accessing cancer genetic counselling. We are planning a cost effectiveness analysis, and we're also partnering with the Healthcare Interpreter Service to investigate whether culturally and linguistically diverse patients and interpreters find it a satisfactory way of doing appointments to have, thank you, the patient in one end, the genetic counsellor in another, and the interpreter in another, and to see if a 3-way video conference works. I'd just like to thank the patients and genetic counsellors who participated in the study and the TCRN for funding, and you all for listening. Thank you.
Thank you, Tina. That was fantastic. Do we have any questions? There's one down the back there.
Hi, my name's Chloe. I'm from Sydney Local Health District. My question was just in relation to the funding. So treating them via telehealth in their home, was that still covered under the funding model as if they were to come into the hospital?
Yeah, so we're all funded, the genetic counsellors at least are funded by ABF, so it doesn't really make a difference to us. My understanding is that there's some complexities with the Medicare funding, so when our geneticist, who's a specialist, we do telehealth for local patients actually with her, but I must say I'm not entirely across how the Medicare funding for that works, but we haven't encountered any major issues that I know of yet. Yeah. Thank you. Is that it?
I imagine there's not a huge number of genetic counselling services in New South Wales. How many are there?
Sorry, I didn't actually explain what a genetic counsellor is, but I guess if we know. In most major hospitals you have one, so I guess there's probably about 15 across the state. So there's probably about 8 in Sydney, and then there's some rural outreach clinics as well. Prince of Wales is quite a big one, so there's 6 or 7 genetic counsellors, and we kind of some of us work part-time, but there's a few of us around, and I guess a lot of you might know a genetic counsellor in your local cancer service. Yeah.
And how do patients get referred into that service?
So we often get referrals from oncologists when they're seeing a patient. We get lots of MDT referrals. We see a lot of GP referrals as well. So people can be referred from a variety of different avenues. In EviQ, there's a cancer genetics section of EviQ, and there's some referral guidelines in there. So if you did ever want to refer to a patient, there's some advice there as well.
Wonderful. Could we get another round of applause for Tina, please?
Thank you.